I'm Elisa Frenz. I'm working for Health Proc Europe Association, a non-profit organization representing the interests of public and private healthcare procurement professionals.
I am Dani Havenit. I am the chairman of EPA, CEO of Mercure Hospital Belgian Procurement Association. And as EPA chairman, we bring together the public procurement of all different countries inside of Europe.
So who are we? We're a joint venture bringing together the EPA and Health Proc Europe Association as an ecosystem for European healthcare procurement, public and private side. We want to bridge our best practices from Europe across the world and vice versa to even enlarge our community beyond the borders of Europe.
As the European hospital and healthcare procurement ecosystem, we believe in the power of procurement functions to increase accessibility to healthcare by making use of existing financial resources. The current challenges underline the urge to rethink the role of procurement. With healthcare's climate footprint contributing almost 5% of global net emissions and Scope 3 emissions as high as 60%, spend in healthcare matters. Understanding the purchase of goods and services is the backbone of procurement. Now is the time for procurement to co-lead with healthcare C-level, to leverage decision-making and ultimately improve the well-being of communities. That's why we're working on initiatives like Project Procure. Applying the principles of transparency and comparative pricing, we're enabling healthcare institutions to employ objective metrics to drive decision-making in the interest of financial health, exchange best practices, and to achieve transparency inside a highly digitalised ecosystem. Procurement is a key topic in healthcare, but it requires a global, collaborative approach. The professionalisation of the sector goes hand in hand with ongoing training for procurers. For this reason, together with the IHF and the Dutch Procurement Association Navy, we are launching the Capacity Programme for Hospital Procurement Leaders. The programme combines an academic approach with the practical work of the operational procurer and has been co-created by buyers for buyers. It addresses the key supply chain issues faced since the beginning of the pandemic, including global collaboration, patient and pathology-centred approaches, as well as the exchange of best practices. The IHF network and community is a facilitator, co-creating, with us, future-proof processes for the global healthcare industry. Last but not least, we are injecting new ideas and innovation from startups into the hospital and healthcare sector, whilst working to improve communication and cooperation between healthcare and procurement professionals. There is still a lot of work to be done. We are pleased to be able to support IHF members with our knowledge and experience and to disseminate best practices which can drive collaboration and accelerate change. The Pan-European Healthcare Procurement Summit is a joint venture between EPA, the European Health Public Procurement Alliance, and Health Proc Europe Association. Together, we represent 12 national public group procurement associations. Health Proc Europe Association is a non-profit interest group of European healthcare purchasers, providing the catalyst to transform healthcare procurement by driving innovation, skills and leadership, as well as digitalisation. We represent an ecosystem of more than 5,000 hospital and healthcare institutions, with a combined purchasing volume of €25 billion for medical devices and consumables. In September 2022, we brought together over 500 procurers from around the world for 2 days in Brussels to share knowledge and exchange views on the topics of sustainability, transparency and digitalisation. Our mission is to elevate healthcare procurement by sharing information and best practices in order to bridge the gap between procurement and healthcare management, driving the agenda towards a more sustainable future for the healthcare sector.
So we are very happy of having the opportunity being a member of the International Hospital Federation and bringing in our European knowledge, experiences, and best practices. But moreover, we want to foster exchange on a global scale and learn from other international best practices from a procurement lens.
And one thing is clear, that the lessons learned from COVID and all the problems we have discussed 2.5 years ago, supply chain management, transparency question, digitalization, the whole sustainable discussion is a worldwide discussion and can't be only on a regional, national, or only a European level. That's why we want to invest our forces in a worldwide network.